I hope everyone's having a great morning. My name is Irini Basilius. I'm a pediatric endocrinologist at McMaster, and I have the privilege of being the chair of the CBME Faculty Development Committee at our postgrad office. And I'm joined today with a fantastic team who has put together quite an robust academic coaching 2.0 Beyond the Basics workshop. Allison, if you don't mind starting to share the slides. So we are hoping to end right on time for 12 o'clock and to respect everybody's time and the busyness of everything and to really engage in this workshop. Really, I wanted to start by saying thank you to everybody who has shown an interest, and thank you to all of our academic coaches. Academic coaching has definitely kind of taken off and is frontline and center. And it's something that we've been doing kind of organically over the years, but with CBME formalizing the role of the academic coach has really come to center stage as an important glue that ties in all of CBME and supports to residents. For those who were able to attend the Coaching 1.0 workshop that happened just recently, as I was saying, the dates are all blurring into one. It was either last week or the week before. This is where we talked about the concept of academic coaching and differentiating it from other roles that we all play, knowing that we wear multiple hats all the time and sometimes all at the same time. And so being able to really focus in on what a coach does and what the value of coaching is. And so I'm just going to share with you the workshop development team. It took great, fantastic minds coming together. I'd like to thank Dr. Mary Zakos from Pediatric GI and chair of the CBME Committee in Pediatrics, Heather Whittingham from our intensive care unit, Lisa Kaliza from our CBME office, Blake Yaraskevich from neurosurge, Ronish Gupta from Pediatric ICU, Spencer Van Mill, who was our resident representative on our workshop development team from Pediatrics, Naveen Sidhu from Pediatric ICU, Parveen Wasi, who is known to everybody, and very happy to introduce our guest speaker today, who is Catherine Munn, who's the Assistant Dean from Resident Affairs, who is instrumental and will be sharing a lot of expertise and resources with us. This workshop is meant to be very interactive, so we've embedded a lot of breakouts, and role plays and discussions. So this is really up to you how much you want to put into it. We might be calling on to you with your acting abilities as well in breakout rooms, but completely participate however you're comfortable with. We're going to start by summarizing coaching and establishing the Educational Alliance, a bit of a summary of the workshop of Coaching 1.0, and Blake Yaraskevich is going to lead us in that. And then for a bit of time, we're going to be talking about a concept of motivational coaching, drawing on motivational interviewing skills that we use for our patients if we are clinical, and using that for educational coaching or motivational coaching. Then we're going to have a little bit of a break and come back and have some time to practice some of these skills in 2 different cases. And then we're going to wrap up by talking about the resident in distress and then take any questions and end by noon. And so with that, I'd like to make sure that everybody knows what our learning objectives are. We are going to be sending you an evaluation, so hopefully we are meeting our learning objectives. Speaking of evaluations, the reason why we have Coaching 2.0 this year is really based on feedback from last year's session, and wanting to get more hands-on practical coaching skills. And so we do value all feedback that you have, and we incorporate it into our future offerings. So please do take the time to be completely honest with us about what we've done well and what we can do better. And with that, I hand over to Dr. Yaraskevich.
Thank you, Ernie. Good morning, everybody. So firstly, before we get started, I want to just apologize for the brevity and breakneck speed at which we will be reviewing Academic Coaching 1.0. It's usually a 3-hour workshop, but we're going to do it in a few minutes here just to review some of the goals. So I apologize for that. So firstly, when people think about coaching, typically people think about, put me in, coach in the sports model and football and soccer, all those things where it's really kind of a well-established part of society. The role for academic coaching and coaching in a residency setting is not necessarily the same, but it has a lot of the same elements and has a lot of the same goals behind it in terms of really trying to get the best performance out of, instead of an athlete in the sense, the best performance out of a learner and a resident. So there is really the concept of a professional coach, and that's kind of what we'll be talking about today. Now, the Royal College, when they started developing CBME, realized the need for having coaching as part of the shift in how we are educating residents. So, as part of teaching to competence, they realized that even the word competence can have negative connotations in terms of graduating a resident, but coaching needs to be done as part of the new model to make sure that they're progressing in the way that they are supposed to. So the Royal College kind of has this little graphic released that essentially, when you think about coaching in a resident model and in the teaching model, there's two separate areas they've parsed out. One is coaching in the moment, which is really what exemplifies a good educator, and it exemplifies what a good supervisor does in the day-to-day clinical setting. And that's not really the portion that we're going to be talking about a lot today specifically, but the coaching over time is the other real half of that. And that is where we are longitudinally following someone, and instead of having those interactions directly with the resident, we're actually taking more outside evidence, and we're using that as data points to coach them over time to meet specific goals which you are working on to set with the resident themselves. Next slide. So no presentation would be complete without a Venn diagram. There's a lot of roles that we take as educators, and that can be mentor, teacher, and coach, and really these terms overlap. And in certain scenarios, you may be having a different role. There are some times where you may be mentoring residents, but being able to identify and have a separate goal as a coach is quite important in the Royal College model itself. So some of the skills that we talk about that are really important as being an academic coach is just the outline of the few things we'll talk about next, is the ability to develop an educational alliance and make sure that you have some degree of a positive relationship with the resident. That's kind of the foundation for coaching. Working on goal setting and helping refine goals, and we'll talk about that briefly in a minute. Eliciting reflective practice and working with them to understand what their actions are and what progress they're making to be able to achieve some of those goals. And then also because of the role of the academic coach within the competency committee, or their interaction with the competency committee, be able to understand how to interpret some of those assessments. Go to the next slide. So the role of an academic coach, just as some bullet points here, this longitudinal education relationship with the resident. It's got this shared goal of helping them achieve this personal excellence. So the mantra that we typically might use is that you teach to competence, but you coach to excellence, and that is not necessarily just the domains of what are identified on their individual either ITERs or identified on their individual assessments. So you're going to participate in regular performance reviews, take those data points outside, synthesize feedback, and help them digest some of that feedback in order to set goals and really use that information to improve upon their performance overall. Part of that is going to be reflection on the feedback itself, and interpreting feedback is sometimes one of the harder things to do as a resident. And then in terms of continuing along in this longitudinal role, follow up on the action plans that you've developed with a resident, follow up on the progress that they're making, and then really try and foster this self-regulation of learning and foster this kind of internal coaching over time, so that once they're through residency, that they continue this as as reflective practice to improve their performance during practice itself. So coaching over time, if we go to the next slide, really has a main central focus. So in the center there, we've got this cycle, which is what the assessment and feedback cycle that is done as part of coaching. So adjusting learning goals. So for setting those goals, so really just goals there at the top, making a plan to address some of those goals, helping implement those plans or find ways to implement those plans, specifically monitoring their progress, collecting some of that data, and then using that to assess and feedback into their goal setting. So it should be an iterative cycle essentially. And on the outside there, you've got those gray boxes, really where the coach is going to be facilitating development of goals, guidance, suggestions, facilitation, providing periodic progress reviews, and assisting in interpreting some of that data and setting the goals with the actual learner. Next slide. So in terms of the actual specific action items for an academic coach, and some of you will obviously, or most of you will be familiar with this in that role or being soon exposed to that role, really developing a rapport with the learner, establishing their goal, a shared goal of professional development, fostering a growth mindset within themselves, setting expectations for the meeting, discussing confidential and boundaries to develop trust and reassure them that this is not an evaluative role, that this is a coaching role where their performance is not being assessed by you, but they're finding ways to improve their performance based upon this external data source. Next slide. So what that's going to be means meeting with them regularly, reviewing the data points that they have, helping them digest some of that, and then bringing that back to the competency committee as reports as needed, and then depending upon the competence committee, really preparing a report for the competence committee to review, and the logistics of that will vary based upon your competence committee itself. If we go to the next slide, one of the major foundations of this is really educational alliance. So people are very familiar in medicine with the therapeutic alliance, and specifically in things like in psychotherapy, where you're really the kind of four main blocks of an educational alliance, or even the therapeutic alliance, is firstly establishing trust and having a relationship with them. But the key components are actually agreeing on goals. So number one, being able to have goals which are in common. So goal setting is really important. Then agreeing on how you're going to achieve those goals, and figuring out a path to achieve those goals, and then longitudinally having that relationship where you can have that iterative feedback throughout it. If we can go to the next. So a shared understanding of performance and standards is really key. As I mentioned, negotiating action plans based upon what the goals are, and then really helping them understand that you're working together to meet that goal, and then being able to digest and create opportunities for feedback within their practice. Now, there's a number of models that this can be done through, and I'm not going to be covering them, but just to briefly introduce them, that if you're not familiar with them, one is the R2C2, which stands for relationship, building a relationship, exploring reactions, exploring the content of the feedback, and then coaching for change. The GROW model, which is again common terms that we've been already talking about: goal setting, determining what the reality is of their current performance, developing options and how to move forward, and then W for way forward, or what they'll do to achieve those goals. And there's also things like coaching feedback grid, where you're able to help process the feedback. So we'll just go into the summary. This is really a whirlwind tour, as I said, of coaching, but just to introduce some of the principles. But really, having an educational alliance and establishing that you are working together with the learner to achieve excellence, and having that understanding with the resident, helping them interpret data, promoting learner reflection on their own feedback, both stuff that's given in the moment and also stuff that's documented later, helping them by preparing for competency committee and debriefing the competency committee reports, reviewing their performance, setting achievable goals and making them accountable to their goals, and then investing in learner growth. So there, in about 10 minutes, you have all you need to know.
Thanks so much, Blake. Can you hear me okay? Yes. Okay, good. I'm thanks so much, and looking forward to talking with all of you about motivational coaching. There's a group of us, all of us here, that have worked on applying the field of motivational interviewing to the ideas behind academic coaching and what we're calling motivational coaching. And as we entered into this process, we realized that there were actually some smart people already that had this idea at Vanderbilt. So we are going to include some of their videos and things along the way to help illustrate some of the concepts here. So next slide, please. So if you remember nothing else about motivational interviewing in the context of academic coaching, it would probably be this, and this idea, a quote by the poet Walt Whitman, which is to be curious and not judgmental. So taking on that stance is very important and key to being successful in using motivational interviewing approaches or motivational coaching. That's my little pandemic puppy, Maisie, who I always try to weave into every slideshow I do during the pandemic. So what we'll be doing is we'll talk a little bit about some of the ideas and principles behind academic coaching, and then we're going to have a chance to watch one of the Vanderbilt videos and have a brief discussion in the chat about that. And then with Spencer and Heather adding their comments about observations on those videos. And then we're going to come back and talk a little bit more about MI, and then we're going to watch a second video and have a chance to debrief on that one and to invite you to put some comments in the chat as we go through, and then we'll wrap up of this section. So next slide. So why motivational interviewing? So some of you will be very familiar with the concepts of motivational interviewing from work, but essentially motivational interviewing originally was brought to medicine to help healthcare professionals and doctors work with people to make change. How when we need to make behavior changes, we're quitting smoking, reducing drinking, all of these behavior changes that are really important to our health and mental health, doctors often have to have discussions with patients, clients about how to do so. And so instead of the traditional approach, which is what we often fall back into if we're not careful about sort of just giving advice and expert advice to people about what they should do, with the clinician acting as an expert in that manner, motivational interviewing kind of turns that sort of on its head. And the sense is not to say that giving advice and expertise is not important, but that in making changes in behavior, it increasingly has been shown that that's not a really very effective approach. And what it actually can result in is that when people are ambivalent about making a change in behavior and they receive kind of advice, directive advice, it actually elicits a more defensive, a kind of uncomfortable, powerless resistance from them, and really doesn't help them to move forward to make the changes they may need to make. And this obviously sounds really deceptively simple. And I would say, as you listen to me and to watching the videos, it'll seem perhaps, if you haven't sort of tried it on, very simple. It's like, okay, we all know this is being non-judgmental and curious is really important. But the work is actually in practicing it. And dare I say that if you have teenagers or young adults at home in a pandemic, or a partner at home, as I do, these are skills that you can practice on an everyday basis as you listen to and have conversations at home with teenagers and young adults in particular, and can be really helpful way to practice. So next slide. So what MI is and how we apply it to coaching is in this way. So it's really a collaborative, a person-centered approach. And the idea is to elicit and strengthen a student's motivation to change through the course of a conversation. So it's an approach and a mix of different techniques. It's more of an art than a science, but there actually is a very robust evidence base behind the use of MI in making changes in various kinds of behavior. And really some of the core ideas behind it is that we, first of all, identify targets for behavior we want to change. We try to evoke or elicit motivation from a student or a person to change. And we really view ambivalence toward change, or setbacks, or what we might call relapses, as being part of the change process. So those are expected things. We're all going to go 2 steps forward and then 1 step back, but we're going to keep climbing up the staircase. It really minimizes confrontation or disagreement. And not to say it avoids that, but it just sort of tries to come at disagreements through approaches other than confrontation. And really, I think because of the evidence on what works when people are trying to make changes in their life, it really emphasizes three things. And one is the autonomy that people need and the freedom they need when they're making choices to make a change. The second is that they need to feel their own competence, their own confidence in the ability to make a change, and that they can relate to other key people as they're trying to make a change in their life. And it focuses on how do we help residents or learners focus on how to change, what we call change talk. Next slide. So when we think about target behaviors, perhaps in learners or trainees, we think, we of course go to our CanMeds framework, we think about some of the behaviors within undercare that we might want to be focusing on. So for example, if a trainee is having difficulty in the area of professionalism, that might be there might be a behavior in the area of professionalism that we're trying to target through academic coaching. And this slide is also to remind us, though, that while we are going to choose, behaviors or consider target behaviors, we never want to forget the environments that impact the trainee. So for example, in a school and work environment, if there, for example, is bullying in the workplace. So if a trainee is experiencing bullying and we are seeing avoidant behavior, say they're not wanting to seek evaluation or feedback from a supervisor, that may be a very understandable, and there may be a different approach if we find out that there is kind of some bullying going on there, and that would be leading them to avoid that, not it being a target behavior. So just to never forget that the environment around the resident or trainee is always important, even as we choose behaviors to work on. Next slide. So in motivational coaching, different to sort of supervision or oversight or direction, the coach works kind of alongside. The idea is working alongside the trainee versus sort of the supervisor kind of overseeing or directing. So very much more in a coaching role. Next slide. And this is sort of one of the acronyms. MI is quite big on acronyms, but this is kind of a helpful one to sort of put on the cape. So when you're thinking about wanting to try or practice MI with a resident or a patient or a family member, the idea is you put on the cape. So the cape, it means that you're looking to collaborate with the person instead of confront the person. You're looking to kind of accept who they are and where they're at, no matter what that is, versus judging. You're looking to partner with the person versus direct them in some way. And you're looking to evoke change. You're looking to evoke their ability and their power and their wish to make change, rather than to impose your own or your wish for them to change, or to tell them how you think that they should want to change their behavior. Next slide. So some of the foundational kind of principles for MI are these four, and they may sound a little bit repetitive, but in the sense of expressing empathy is pretty key, so that we really have to listen with empathy to their perspective on the academic situation in order to help elicit and find ways to make change. Another key piece of motivational interviewing is the idea of developing discrepancy, so that when people feel that the choices they're making are not aligned with their values or their other wishes, then it can be easier to see the need to make change. So if they feel as though they really want to successfully complete this block, but there is a behavior that is getting in the way, that's developing a discrepancy when we point that out. The other key points are that we roll with resistance in MI. So we're not confronting or attacking or trying to have an argument, a logical argument about whose way might be best to make a change in behavior, really rolling with that resistance, trying to understand where the person's coming from and supporting their own beliefs and wishes to make change. Next slide. So I think as we go through, this is a good thing to remember, both for ourselves, but also for residents. This is actually a photo taken by Ian Laidley, who's an emerge doc, some of you may know. But the idea for us all to remember as we practice and try these on is that you have to do the best you can until you know better. And then when you know better, you do better. And with MI, you may find as you try to practice that you will realize that in the past, as I have realized, that when you try to adopt these approaches, you realize maybe that you've been doing it not quite right in the past. Because sometimes we as physicians, especially, I think we're very much trained to give our expertise, share our advice. And so we really have to adopt quite a different mindset in order to coach in this particular way. All right, so next slide. a few little rules or principles to remember as we go through, and you can watch for these in the videos that we're going to watch, is the idea of rule, recognizing and resisting the urge to correct or inform the person, trying to understand the perspective of the person, to listen reflectively, and to empower the student to make change themselves. Next slide. So finally, really it's about approaching conversations non-judgmentally with curiosity. We're really trying to focus on, as we do this, to evoke and encourage what we call change talk, and I'll talk about that more in future slides. And if we're going to be offering advice or feedback, or that often the idea being that we might want to ask for permission to do so. So like, would this be a good time for me to share some feedback with you? So that's just one of the simple things that MI can teach us about coaching. So next slide, and I'm going to turn it over to Heather at this point.
Hello, everyone. I have the privilege of introducing these slides that came from Vanderbilt University. Fortunately, because these videos already existed, we have saved you from having to see our acting skills. So what you're about to see is you're about to see a video between an academic coach and a student. And this is using a more traditional advising approach. So what I'd encourage you to do, so this one does not use the principles of motivational interviewing, just a lot of the principles that Blake had already talked about. And what I'd encourage you to do is, as you're watching it, make note for yourself. You can also include the chat box below, because we will follow up with that as well. But watch the interaction and see what you think is working, what you think might not be working. And at the conclusion of this video, both myself as an academic coach and Spencer, one of our trainees, one of our residents who is joining us for this, will present our feelings about how it went. And then Catherine will give us some specific examples afterwards about how we can learn to incorporate motivational interviewing into our coaching. That will be followed by a second video that actually uses these techniques. So the hope is that we'll be able to compare and contrast the first video and the last video with slightly different techniques. So with that, I'd like to introduce our two actors.
Hi, Tom. Thanks for coming today. I know I called you in to talk a little bit about your evaluation that recently came back. I thought we'd just start potentially by reviewing the evaluation from the pediatric clerkship. Is that okay?
Sure, that's fine. I had a great time on peds. Yeah, let's go ahead.
Okay. So when I was looking over the evaluation, I had specific concerns, which is why I asked you to come in and meet with me about some of the evaluations that that you were argumentative in. Were you able to read the evaluation actually?
I looked over it really quickly, but it just I'll be honest with you, it didn't sound right to me looking through it.
Okay. So what I would like to do is just go through the comments, because clearly I wasn't there.
Right.
And I would love to have your perspective on it so that we can think through this and then try and generate some ideas on how that might be addressed. And if you feel like they're incorrect, I really need to know about that. But let's just go ahead and start with that. The comments say that you were interrupting when you were on rounds in one situation.
I think I know who that was, or who said that. It's not, I'm not. They didn't say anything to me about it at the time.
That's frustrating. I know. Yeah. So I work with people a lot on trying to get them to directly talk to you all. But did you get any sense that was going on at the time?
I mean, no. I mean, they're all really nice on peds. They never tell you when they actually have something to say that they want you to change.
Yeah, but the important part is to actually think about this, and this is data that's coming back. So I think we need to think about how to approach that data and how to understand that perspective that's coming back for you.
Okay.
So have you had times in the past where you've been asked about interrupting? or been, sorry, not asked, but have been told that you were having trouble interrupting, or that you were maybe more confrontational in your interactions?
I mean, I have a blunt personality, and I know that. But in general, no. I mean, no one's ever really pointed it out to me before, and I don't really think it's a problem, to be honest.
So you said that you just kind of looked briefly at the evaluations. I know that in my role, I'm supposed to look through all your evaluations.
Right.
So I've seen some intermittent comments here and there. Are those things that you've picked up on, or do you just not really look at your evaluations?
I mean, I look at them, but in general, there's always, I can generally figure out who wrote them and why they're saying something. It's not. I guess I don't put a lot of stock in the ones that just don't make sense.
Okay, well, so I really think that we need to come up with a plan to try and address these, because I'm concerned that I've seen some of these different comments peppered into your evaluations, and I'd like to come up with some ideas on how you're going to try and avoid that type of perception from other people in the future.
Yeah, I mean, I don't, it's kind of like it's me. I don't really know. I mean, I speak when, like I think there's something, and I try not to interrupt, but I mean, I just am a straight shooter.
Okay. So maybe we can think then about the outcome that you want to attain, whether you want to be receiving this kind of feedback. And there may be certain situations where it is appropriate for you to interrupt or to take charge. But are there situations where you don't want to have that feedback coming back, where it wouldn't be appropriate?
I mean, yeah, absolutely. I prefer that people not think this about me, but it's, yeah.
Okay. So let's think about, I could imagine that you could set a goal of maybe trying not to interrupt. Have you thought about doing that when you're setting learning goals?
I mean, I've never really seen it as a problem before, so no, not really. I'm not sure I still actually really see it as a problem, to be honest.
So I guess that makes me a little concerned, because when I see something like this coming back on a final evaluation, I would call that a problem. And so it makes me a little bit concerned right now that despite the fact that we're talking about this and I've asked you to come specifically for this, you still don't see it as a problem.
I understand, it's your job to kind of talk through this with the feedback about me and everything. It's hard for me to think about exactly when this occurs or who it's coming from necessarily.
Okay. All right. Well, let's see if we can get some more information from the pediatric clerkship, so that we have more specifics to try and generate ideas. And can you try and do some reflection on this as well, and then we can meet again in a little bit and talk again?
I mean, definitely. Yeah, I'll think about it. I'm going to think about it now. But I'm just not sure how much headway I'm necessarily going to make on it until I have someone telling me in the moment necessarily that something's happening.
Okay. Well, thank you for coming and talking to me today.
Yeah, so I think a lot of good points in the chat, and a lot of them kind of align with my initial impressions from it too. And I think the first thing that kind of jumped out to me as a learner who, oftentimes feedback is kind of funneled to supervisors, PDs, academic coaches, and it's just something that's very, very frustrating to indirectly receive negative feedback. And you can kind of see how he responds to that at the beginning. And the frustration he expresses because it wasn't directly delivered to him. The other things that we kind of touch on a little bit is that it's almost as if he feels helplessness. He didn't feel like he was able to kind of say his piece, give an explanation, talk it through with the supervisor. And I think that really contributed to the defensiveness that he's exhibiting in this. And that's really impacting that academic coach learner dyad. It wasn't a super successful interaction, and he goes through it and doesn't actually end up acknowledging a problem. There's not really a good concrete plan that he seems to have a lot of motivation to buy into. The other thing as well is within the comfort and the level of rapport you have with your learner, it's also okay to try to gauge a little bit with while keeping in mind their psychological safety, to see if there's any stressors or anything that's going on that might be kind of contributing to this performance. Because we kind of say in this last line, don't underestimate the impact of outside stressors on clinical performance.
Okay, it's my turn. So my first impression when I watched this, and I watched this before I had an introduction to motivational interviewing. So I didn't have the 8 to 10 minutes that Catherine initially presented, and I thought, well, it's an okay coaching conversation. She did review the evaluation and solicited the learner perspective. There are things that, and if you go through our chat, which was in the moment description of what we were seeing, she was a little bit more directive about it, as many of you observed, and she solicited his perspective, but she didn't really give him a great deal of time to reflect on why or any of the contextual information. But she sort of did that in essence. She at least started it the way we've been taught to. She did inquire whether this was a pattern of behavior and whether there were similar comments across multiple evaluations, but it maybe wasn't done in the most supportive way. She did express concern that this was a problem, and that came up in the context because the learner himself wasn't acknowledging that this was a problem. He was dismissing it. And I think we've heard from Spencer perhaps why he was dismissing these observations. He may not have agreed, or he may have become quite defensive about how this was coming up. But when she wasn't receiving back from him the recognition that this could be a problem, she chose to express concern that it might be a problem, and then recommended developing a plan to address it. She didn't specifically suggest what the plan was necessarily. And in fact, they never got to a plan at the end. But again, she was following sort of the idea of, okay, well, we've identified the problem and now we need to come up with a plan together. But this became a challenging interaction for her as a coach and for the two of them as a dyad, because the learner never actually acknowledged there was a problem. It's a lot easier when the learner says, yeah, that was really awful, and that's something I'd really like to work on. But so many of us in our coaching relationships actually don't have a learner who either accepts the evaluation or recognizes their areas for learning. To go through and borrow from some of the thoughts on the chat, some of the things that could have been done differently. Sophie comments that she's very much following her agenda. She's cutting people off, or cutting him off, excuse me, not hearing him out. He's leaving little traces of information. So there were some comments that he made around his blunt personality, and some frustrations that he was starting to explore that they didn't spend any time to delve into at all. Other people in the group commented on how the conversation, rather than starting sort of collaboratively and empathetically, it really started negatively. I've brought you in today because there were some concerns raised on this evaluation that I would really like to spend some time with. And so rather than soliciting his opinion or whether he has reviewed the evaluations and got his thoughts on the evaluations, we went right into her perceptions. And also in the chat, Ava commented on she's dictating that we need to come up with a plan as opposed to asking him what his goals might be. Blake commented again that she was setting the plan for him. I'm not sure how to pronounce, I think this is a first initial plus a last name, but there's comments made that he feels like he might be in trouble. And in fact, he might be, right? These are evaluations that have come back. And instead of he's feeling very defensive about things. And then Ava also commented that she needs to learn not to interrupt. There were comments around this feeling very paternalistic and very palpable tension. So Bilal commented as well about how it was all, okay, you go back and think about this, putting all the onus on one and not the other. So they weren't working together. So at the end of all of it, the meeting ends. They have no greater understanding. There's no recognition or a plan. The learner is not engaged or motivated to change. And I would say that their relationship actually may be further apart than it started. So I think let's learn a little bit more from Catherine about how she might have done this a little bit differently.
Let's not say me, but how we could do things a little differently, because I'm sure we've all fallen into some of those traps over time. So just to remind, and maybe in the chat, I'll ask a few questions as we go through that you can feel free to chime in on. But the idea that what MI really encourages is a guiding style in a conversation. And so perhaps you could put in the chat what style, as I described them, what style you think she was engaging in here. So what a directing style is really when, and when a supervisor or a coach sort of tells the resident what to do or how to go about doing it. And sometimes that's very necessary. We have to tell people what the expectations are, and then we direct them and encourage them to make a change. However, inadvertently, that can often evoke a defensiveness and a wish to not make a change in that direction. So it actually it can backfire. In a guiding style, it's really more like the idea of a travel guide, so that the guide is kind of working alongside and coaching and encouraging the trainee to come up with a plan. They don't tell the traveler what they're doing on the journey or what to do. They also don't passively follow them, but they kind of encourage and direct the encounter. But the responsibility for making a change in behavior lies with the trainee. And then, so the following style obviously is another style, and that's really more a more passive style when it involves kind of listening to a learner and hearing what they have to say about what the challenges they might be experiencing, or and really not offering a lot of direction or advice or even guiding. And so maybe kind of obvious, but I don't know where you think in the chat where that last interview might fall more towards the directing, the guiding, or the following. You can feel free to give a comment. Next slide. So as we engage in kind of this guiding style of coaching, and I see that people are noticing it's probably a more directive style that she's undertaking. Exactly. So as we look to MI to kind of do this a little differently, we think about sort of 4 steps in our process. And the first is the engagement step. So shall we work together? Let's work together to figure out what we can do to help make your evaluations more successful. And again, feel free to comment in the chat, as to whether or not you felt that she actually engaged him. Did she engage him to want to work together with her to make a change in his behavior? So that's really the core of, as you all know, is the core of any of these relationships, is that the importance of engagement. If we don't have that, it's hard to move up the stairs. And so the second piece would be the focusing on what to change. So is there a target behavior? Is there a target behavior that needs to change, that he wants to change, that might be helpful to change? That would be sort of the second, is identifying that target. Again, do we think that, thinking about, do we think that he and she actually did that, focused on that, or not so much? And then the third step being, how do we evoke interest or engage or encourage the trainee to change? So why change? So was there any conversation here about what are the, say, pros and cons of making a change? And that's really where sometimes motivational interviewing can look quite different than other approaches to supervision or coaching, in that it's very much encouraged to focus on what are the good parts about changing this behavior, or what are the hard parts about changing, or why might you not want to change your behavior? Why might you not want to behave any differently than you did on PEDS? And then moving into finally the sort of how to change. So how might you do things differently so that you aren't eliciting this feedback from on your pediatrics rotation, or maybe in your next rotation? Are there things you could think about that you might want to do, or you might want to try on? And so that these are sort of the 4, but all the way along the way, promoting what we call change talk, meaning we want to hear change talk. So the resident, the trainee, coming up with the things that they can do to change their behavior, not what we think that they should do to change their behavior. So the change talk coming from the resident themselves, from the trainee. And then all the way along the way that we're encouraging the folks, like, acknowledging their strengths, and addressing the weaknesses and lack of progress when needed, but really affirming their strengths and their progress. Next slide. So the idea here, and I actually we'll just focus more on the change talk piece, but the idea of the writing reflex is the idea that when you start to tell people what it is that they're doing wrong, we often all do this. We identify a problem and then we try to fix it. And that's because we're compassionate people that want to help people fix their problems. But often, if you can reflect yourself on what it's like when, say, for example, someone says to you, "I'd like you to cook dinner and I'd like you to make chicken." How do we feel when someone says that versus, what do you think we should do for dinner tonight? We've got some chicken. Do you think that would be good to think about having? It evokes a very different reaction in ourselves as it does in learners. So really what we're trying to evoke is that change talk, that encouragement for them to see why it is, or what it is, why would they want to make change? And that's the kind of change talk, the why change. The why not change is kind of what MI talks about, is sustain talk. That's the idea. We're just going to keep things the same. We're going to do things the way we always did. And I think probably you'd agree that we could see a lot of sustain talk in the last conversation, a lot of reasons why he's not sure it's really worthwhile changing. Next slide. Again, just another little kind of acronym that MI is sometimes helpful for is what are some of the techniques we can see and use as we try to do this? And I'd ask you to kind of think about these as you look at the second video. How much of these is she using in the second video? So open-ended questions, affirming the good things that the person has done or that they're trying to do, or the ideas they're bringing forward, reflecting back without kind of giving a perspective or opinion, and summarizing what the person is saying to us. And then, of course, there's always a place for informing and advising, but only when we've done those other things, usually first. Next slide. So very quickly, I think many of you will be familiar with this. This is sort of the stages of making a change in one's behavior. And they kind of go from pre-contemplation all the way over to maintenance of that change. And so the whole idea of the stages of change model that we think about in MI is we kind of try to think about, well, what does it mean? What would it mean, or what would it look like to be ready for a change? And how can we guide people through this process? And so again, as you watch the next video, you're going to think about where the learner, or you can think about, in this case, where was the learner on this stage of change? So next slide. So very quickly, in pre-contemplation, really the person is not considering a change. They don't think there's really anything they need to change. And our work as a coach is to kind of help them think about, well, what might it look like to make a change? How can we raise their consciousness, raise the possibility of change? Next slide. Contemplation is where it's like, I think it's an issue for other people, but I don't think I need to change it. The person's aware there's maybe a problem, but they're not really committed to making a change. And so here we're really trying to elicit, what are the pros and cons of making a change? Why might you make a change? Why might not you make a change? Perhaps think about where you think our first video was on this. Were they in pre-contemplation, or were they in contemplation, or were they further along? Maybe if you want to make a bold proclamation, you can put it in the chat. Next slide. So along the road next is sort of preparation. This is like, I wish I could change it, but I don't know how I'm going to change my behavior. I don't know how I'm going to come across better on my rotation in pediatrics. And so here we're trying to help and work with the resident to identify change strategies. How might you change if you were going to make a change? How could you go about it? Or how confident do you feel in that ability to make a change? And how can we increase your confidence to make that change? And then the next slide. And this is where they're ready for action. So they're attempting to make change in their behavior. They're developing alternative strategies. They're engaging with supports. They're opening up to others. They're thinking about ways they can reward themselves. And And they may get frustrated though. They may say, I've tried, but I keep falling back to my old way of doing things. I keep just my old blunt ways. There's no point. And so it's what's helping you to make the change. What else could help you to make the change? Who can help you to maintain that change? Next slide. And finally, the idea of maintaining the change. So once we've made a change, or the learner has made a change in his behavior, and then we're trying to help him maintain it and encourage for more than sort of say 6 months, we're kind of trying to say, okay, the person might say, I think I've got it now, at least most of the time. So we're working on, how can I help you stick with this change? You've made such amazing change in your behavior. You're getting so much more positive feedback on your evaluations. How can you stick with this? What's going to help you stick with this? Okay, next slide. So the idea, again, change talk, focusing on encouraging the person to make change and talk about change in their own behavior versus stick with, I can't really make change. I don't think anything is going to work. I don't know that I really need to make change. And next slide. So I think we're moving into our video 2, and I'll just turn it over to Heather.
Okay, so this should not be interpreted as one coach got fired and the next coach got supplemented in because of a bad experience. The woman in the blue shirt is actually the person who had given the presentation. And so she's stepping in to demonstrate the principles of MI in this same conversation. So same student, same evaluation forms, just a different way to go about it. And I look forward to hearing your perspectives in the chat as we go along, because I thought you guys were so insightful for the first one. So both what you see and whether you think that this is something that you could adapt to your conversations.
Yeah.
Tom, thanks for coming in today.
Yeah, no problem. Thanks, Dr. Benningfield.
So I got the feedback back from your PEDS rotation and really wanted to sit down and talk with you about it. There are some things here that led me to be a little concerned.
Oh, okay. Yeah, I mean, I read it too, and yeah, I read it, and it didn't. I'll be honest, it didn't really make sense to me.
What did you think?
Well, I mean, I thought I think PEDS went well.
Okay.
And I think, my grade on the shelf reflects that it went well.
Mm-hmm.
I picked up patients like I was supposed to. I, helped take care of my patients. I felt that I participated really well on rounds going around. And so, there was some feedback in there that I think it's from a couple people who really just didn't like me.
Okay. All right. What was the feedback that you heard that made you think, oh, I know who these people are, and they just didn't like me?
Well, I think there were a couple times on rounds where rounds were going really slow, and like someone was asking for my plan, and I gave something, and I forgot to put something in, and so then when someone else was talking, I think I jumped in and said, oh, like this addition, because they were forgetting something, and I forgot to say something too.
Okay.
I mean, and so I think they said that I interrupted them, which it's not really like me.
Yeah.
And I've never really gotten that feedback before.
Mm-hmm.
So I really don't see it being a problem.
And it's really hard to interpret when the feedback that you get on the final evaluation is so different from what you've had face to face.
Yeah, I mean, and to be honest, in PEDS, they smile,
Mm-hmm.
and they tell you great job, and it's just like them not to really give me any feedback otherwise.
And then kind of get you at the end.
Right. I mean,
yeah. Well, if you think a little bit more about those occasions where you may have been jumping in, or like that one time on rounds where you had forgotten something and you came back around and kind of jumped on somebody else, when you think about that, how do you think about what the ideal way to be would be?
Well, I mean, I'll tell you, it's been really hard for me to think about this in general, just because I really don't think it's a problem, and I never heard this before. I mean, ideally, I wouldn't need to, because someone else will remember everything they're putting in, or that I would say everything initially too.
Right.
I just want to make sure I thought it was patient care, and so
Sure.
I jumped in.
Right. Well, and you know that nobody's going to be perfect all the time. And you recognize that sometimes you are going to forget things. And patient care requires for you to be on top of it and ready to step in and recognize when you've made a mistake.
Right. And so, I mean, I feel like that's why, if that's the moment that they're referencing, and I think it is I can't think of any other time really
Okay.
during, that's what I felt like that was more important for me to, you know, add in those pieces of information.
Sure, sure. Well, I wonder if we could think a little bit about the process of even getting feedback and how what you're getting from people in the moment may not reflect kind of that piece of, are there things that you could be doing differently?
Right. Sure. Yeah. I can see that being the case. I mean, you know, I don't always tell someone when they're annoying me at that moment or
Sure.
whatever.
And that's an important skill to be able to do.
Mm-hmm.
You know, and thinking back over, so this is clerkship year, over the previous time that you've had, have there been other times when you've gotten some feedback like this about interrupting?
I mean, not that I've. Yeah, I think you're talking about the CBL feedback that I've gotten before. Yeah, I mean, those were all little particular instances where somebody, you know, like I jumped in and said something, and I really, you know, I really think that those. I have a blunt personality.
Yeah.
I know that, and I know that it can rub people the wrong way sometimes. It's who I am.
Yeah.
And so I don't. Be honest, I don't put a lot of stock necessarily in those evaluations.
Okay, because this is who you are,
right?
And you're not really interested in changing who you are.
I mean, I'm not interested in changing who I am fundamentally in order to please a couple people that it might rub the wrong way necessarily.
Sure. But patient care is really important to you, and you're committed to doing a really good job by your patient. So if you knew that this was impacting the care that you were delivering, that would be really important to you.
Well, yeah, I mean, absolutely. It's why I'm in medical school.
Sure, sure. And getting accurate feedback from the people that you're working with is also really important to you.
I mean, I want, just like any other medical student, I want to improve. And I feel like, you know, in whatever arena that may be in, but I don't want to change who I am because of a couple people
Sure.
that don't appreciate my style necessarily.
Sure. And at the same time, if that style is getting in the way of doing your best, you're interested in thinking about how you can modify it in certain circumstances to be the best doctor you can be.
Right. If it's impacting patient care, sure. Whatever it needs to be.
Okay. Well, I wonder if we could think a little bit about what you might do next.
Sure. I mean, I don't necessarily have any great ideas about it right now.
Well, let's think about that some more.
Okay.
Is that?
Yeah.
Okay, so that was a very different style of video. And I think all of us had a little bit of reflexive sphincter tightening in the first experience. And I don't know about you, but I kind of relaxed a little bit, even just watching that second one a little bit. It just seemed less confrontational, a little bit more alliance building, to use some of the words that Blake had introduced. So from my point of view, and I'll go through some of the chat thoughts as well, she used some motivational interviewing techniques. She brought up the evaluation and immediately asked for his impression. So a number of you in the chat commented on how it was open-ended, how she was really seeking his impressions. And she did a good job, I think, of affirming and reflecting his feelings empathetically. Because she used open-ended questions, she got more details. If you think about this one and compare it to the previous video, who talked more? In this particular video, it was mostly the learner. I learned a ton more about this resident and what had happened than I ever did in the first video. So we got his details more, we understood his perspective. She also used reflective techniques, so the learner felt heard. So when she talked about, particularly when she started talking about his strengths, which I'll go into in the next point, he really felt like she had gotten him. She could elicit, again, more information that way, including his reluctance to change. When he said, like, this is my personality, I have a blunt personality, and, you know, I'm not really interested in changing who I am to please a couple people that it might rub the wrong way. in the chat, there was really great comments around the discrepancies that were coming up. So she was able to pull out from him the things that he self-identified as strengths. So he talked about patient care, and she reflected that back to him, getting accurate feedback and how important that was for him. And then she was able to identify that there may be a discrepancy there for him when his behaviors might impact patient care. And she was able to have him see it from a slightly different perspective. And I wouldn't say that he was at the end of this particular interaction, I wouldn't say that he was necessarily completely committed to change, but I think we started to see some glimmer that he was starting to understand or identify how there may be benefits to change. And then instead of coming up with the plan as was described in the previous video, she said, well, I wonder what you thought might be the next steps. And so using words like I wonder and using and to build on his statements was a nice way to encourage him to move on to the next natural ideas about where to go. Obviously, we got cut off here at the end of this interaction, and I would have liked to hear what happened next. But this is a great way of showing someone who was not willing to change in the first, and in the second was much more open to the idea. I'd like to invite Spencer to give his perspective as well.
Yeah, thank you. Are we able to go to the next slide? Thanks. So exactly, I think Dr. Whittingham covered a lot of the finer details of that, but I think just kind of some big overarching points from a learner's perspective here is that we heard a lot of phrases for the first interaction, like paternalism, things like that. And this one, it definitely just felt like the coach was on the learner's team. There were no accusations. There was just presenting information and prompting of reflection and things like that. And I think that just helped with the rapport. It helped the learner kind of let his guard down a little bit and slowly kind of inch away at getting that insight that's probably necessary to actually get some of this change behavior going. And yeah, essentially that, I think this is all kind of a product of those affirming aspects of MI that we had reviewed before. The last piece of this that I wanted to just kind of bring up as well is, I think it's very, very valuable to have that additional information that she brought up about the small groups, the small group feedback that he had gotten previously. And I think that just kind of emphasizes the value of the longitudinal aspect of the academic coaching dyad. Having someone who you know well, so if there's one subpar evaluation, you have a rich amount of context to interpret it. If there has been some emerging new behaviors, you're able to recognize it. And I think that just kind of adds to the value, especially in some of these longer programs that you're a part of for 4 or 5 years. Having someone that's known the trainee the whole way can really help navigate these scenarios when they arise.
Thanks so much, Spencer. So I think we're actually running a couple of minutes behind. And so I think we won't spend a lot of time wrapping up at this point, but just to say that really it's an introduction to the ideas of MI. I think some great points in the chat, Michael, noticing that also that they didn't actually need to come to a plan that time, and really that you have to move up those steps, that staircase, and really the engagement piece is so key. And she did such a lovely job of engaging him in a different way that did not elicit defensiveness. And so I think just to remind ourselves as we try on these techniques for size, and also to remind residents, is that, often we think that, that path to success is very straight, but as we all well know, it really looks kind of messy, and we're going to make mistakes along the way. But trying some of these new techniques and new approaches can be really empowering and helpful, and make our interactions more enjoyable. So I'm going to stop there, and we will share these slides, and there's some references in the slides for you, some key references.
Thank you so much to Catherine and Heather and Spencer and Blake for taking us through the first section of our workshop and laying down the foundations. We are running slightly behind, but promise to catch you all up on time and end it by noon. But if you do want to take a say 8 to 10 minute break to refill your cup or do whatever you need to do, it is 10:06 right now. We will restart at 10:15 with the second section where cases and interactivity. Hello and welcome back to everyone. Hope you got a great 10 minutes or 9 minutes of rest. And we're going to go ahead to the second section of our workshop where we have some cases to present and then to go into some breakout rooms and practice the motivational coaching skills that we have just been introduced to. So I will now be handing over to Naveen.
Great. Thanks so much, Irini. And thank you, Catherine, Heather, and Spencer for that great discussion on motivational coaching. Certainly a lot that I'm still learning. And now what this does is it allows us an opportunity to apply some of the techniques we just heard about. So we're going to be divided into breakout rooms, and you'll be going through with case one. And so case one is the case of Samir Singh. I want to do one of those movie disclaimers that any resemblance to any actual person was by coincidence. This is not based on any particular person. But in the story, in this case, there will be an academic coach who will be meeting with Samir Singh. Samir is a first-year psychiatry resident. He has received feedback from his general internal medicine rotation that he was chronically late, frequently missed multidisciplinary rounds, and was delayed in completing documentation. I do find anytime things get into the domains of professionalism, that's always a little bit more of a difficult talk, I find, when it comes to that coaching conversation. So it's really good to be able to practice some of the techniques that we've learned. So one person will take the role of the academic coach, one the learner, and there'll be a facilitator in the room as well. The rest will be observers. So in the chat, Allison's going to put a link, if you wouldn't mind doing that, Allison, with a Google Drive file that's going to open up with all of the documents that you'll need for the case. So you'll get that link, just go to it, and then click on the corresponding case one, case two, case one facilitator, whichever role you have. So you can have that pulled up, and then we'll go ahead. The facilitators, if you wouldn't mind bringing back a couple comments. So afterwards, when we debrief in a larger group, we can go and do that together. So just put any takeaway points into the chat when you come back as facilitators, and that'll sort of start our discussion off when we get back. All right, so we will, so I would, again, the link is in the chat. So we'll be, please go ahead and click on it now, because I'm not sure if it follows through once you're in your breakout rooms. The other thing to just mention is that the observers, so there'll be the one person who's the coach, one person who's the trainee, everyone else refer to, it's called our ORS checklist. And so remember, ORS is the open questions, affirmations, reflective statements, and summaries. Watch for any of those happening. And so use your little checklist to make notes, and then you can help and provide some feedback afterwards. So yeah, this is again, just to kind of start flexing our muscles, doing a little bit of practicing, and then bringing it back to the group. So we said we have 40 minutes in total. What we're going to do is shorten that down to 35 minutes, just to sort of keep us on track, so we can get you guys out of here at a decent time. So I'll be about 20 minutes for role play, 10 to 15 minutes for debriefing, and that's about it. All right. So with that being said, we will get into our groups and see you guys when you're done. All right, guys, welcome back after our first case. So we're just going to take about 10 minutes or so just to sort of debrief how that felt. I would say, honestly, at this point, just go ahead and unmute yourself, bring up any discussions. You can also use the chat. If any of the facilitators have feedback that they want to provide back in the chat, or honestly for anyone, I think, we're an open group, so please go ahead and how did you guys think it went, or any other burning questions you have?
I think our group just jumped into it and we didn't actually get to who's going to come back and report. But I feel like if Ahraz is available, he did a lot of the leading in our group and did a fantastic job as a facilitator. I don't mean to put him on the spot, and there he is.
Hey guys, thank you. So no, it went really well. I appreciated the sort of nuanced feedback. We sort of talked a little bit about the how sometimes as coaches we mean well and and sort of want to encourage and motivate and empathize, but sometimes finding that balance between sort of being parental in our advice and our motivation, as opposed to sort of, you know, not seeking the learners to sort of want to please us, but rather to sort of achieve goals for their own sort of well-being and benefit. And sort of how do you tread that fine line? And I have kids, and so I sort of took a bit of a parental approach, and our team picked up on that, and that certainly was appreciated. And then we spent a little bit of time maybe discussing sort of how if you're a third party who's receiving feedback from multiple sources and are just in the role of sort of an academic coach versus sort of the reality where sometimes we are also direct supervisors sort of for the residents and are receiving feedback sort of in real time and have to make those corrections and have to meet with sort of residents and trainees and do those corrections in real time. So how does that shift the dynamic, sort of being a third party receiving a feedback versus being a supervisor and then also receiving feedback and having to make those corrections. So we spent some time discussing on that. And then finally, something that we didn't get to, but you know, maybe others did, was sort of how do you balance the practicalities of time? So if you're in a busy sort of, you know, clinical inpatient environment, do you have sort of 30 minutes to unpack maybe some other social issues that might be affecting the trainee's performance? Or are we going to take a very goal-directed approach and sort of just address sort of the 2 or 3 things that we can sort of correct in the moment? And then how do you balance the two? So those are some of the things that we discussed.
That's great, Aras. Thank you very much. Really, really good points of discussion. And certainly I think things that we're all sort of starting to feel out. So that's really helpful. All right, other thoughts from people in their groups? Anyone to speak up as the representative?
I'll speak up briefly for our group. We had a really good discussion about, number one, how hard it is for motivational coaching, motivational interviewing and coaching. But one of the things we identified, number one, is prematurely coming to a conclusion, or essentially, you know, treating a symptom of the disease rather than the disease. So, you know, identifying individual issues with the ITER or the evaluation, and focusing on those as individual problems rather than a symptom of a larger issue, and how specifically using open-ended questions and using the motivational interviewing technique can help elicit some of those more nuanced problems that might be driving all of these as symptoms of something broader.
That's really great. Thank you, Blake.
I am Mike.
Mike.
I'm going to try to summarize our group's discussion, but others who are in it, feel free to add. I think our discussion kind of focused on three or four main points. First was just the identifying the being open-ended and identifying the some of the background reasons behind why the tardiness happened with that particular resident. It also centered around how to bring up quote unquote the elephant in the room and comfort or discomfort with addressing that that issue, and how to kind of bring up the discussion without in a way that the resident or trainee can actually directly respond to it, but you know, not softening the message too much. And then the last part was just around, and I don't think we came to a conclusion about how to address the trainee who may actually have poor insight or may or may not have good reasons for their behavior, that it may be just difficult to sometimes tease apart someone who has good reasons for doing what they did, or someone who just has poor behavior. And then the last was just in terms of how to, kind of be authentic in terms of the messaging of what the coach might feel might be the problem versus, kind of difficulty in expressing an authentic, impression of what may happen, yet at the same time not being too directive. So that kind of fine balance is sometimes challenging. I don't know if we came to a conclusion about that, but we start to talk about that.
Thank you very much, Michael. Go ahead, Catherine.
I was just going to make a comment that just might be helpful in this sort of motivational interviewing language. So one of the things that kind of goes along with motivational interviewing is the idea of norm referencing. And that's the idea of when we can say, we can comment on a behavior in the context of other residents or other people's behaviors, and that is an okay, in a neutral way to say. So in the case Michael's bringing forward is so on your evaluation, I did notice that, they have commented on lateness. And so first maybe to explore why lateness might be occurring, but also that, lateness is or maybe is not something that frequently has come up on other rotations for him or in rotations with other residents. So like, what do you make of that? So the idea that we're neutrally addressing the issue is fine. Like with that's obviously that has to be done, but it's sort of putting it into context. Where does that sit with you in other settings, and where does that also maybe sit with other residents? Is that an issue that you're seeing with other residents? Are they also coming in late, or is this just something that's happening for you? Or if you have information about that, to refer to that information. So that can sometimes be a helpful thing to think about in this context, sort of that neutral transmission of where you sit. Because we use these techniques with people with addictions, for example, so in the context of, so in coaching, it's not an addiction, but it's not in that same context, but it's still, there's information to be provided in a neutral way that has to be put forward, but it's sort of in that neutral way in comparison with yourself and in comparison with others.
Thanks, Catherine. That's really helpful. Even just from my perspective, how can you still, talk about these things without almost shying away from it? And that's a great way by, comparing to or doing that. So that's wonderful. All right. Some great discussion, guys. All right. But just to keep things moving, I think we'll hold on to some of the comments here. Perhaps, some of those we can bring back in the next case as well. So again, thank you very much, guys. It was great to watch everyone's performances. So keep it up. I'm gonna hand it over now to Mary, I believe, who's gonna set up the second case.
Okay, hi everyone. So yes, another opportunity to apply some of the motivational coaching techniques, but in a slightly different context, and building on everything we've learned so far and practiced so far. So this is a bit of a different scenario. So Taylor Denton is meeting with you as their academic coach, and they are a nephrology resident who is going from foundations to core. So this meeting is to review the anticipated promotion, or at least the review for that promotion. But you're the new coach and you're meeting Taylor for the first time. The previous coach has gone on leave, and the handoff was simply that they're doing fine as a first-year nephrology fellow. So the evaluations consists of some EPA reports with many comments, as well as ITER comments that you would have received. But just to kind of give people the kind of highlights and the details so we don't spend too much time having to review it in our breakout rooms, these are the types of things that came up on Taylor's comments. So planned appropriately, although felt needed to prompt, probe, and encourage you to provide your thoughts. Don't be afraid to speak up and present your impression. You had the right information, but appeared to have trouble making a decision because I think you were worried about being wrong. Every plan will have its risks and benefits. Your job is to balance and prioritize them. And needed some encouragement, but eventually arrived at a coherent plan. So unlike Samir, there's some different types of messages that are coming up in Taylor's comments. And in the next slide, we will again be breaking out into the breakout rooms. We have in the Google document more details if people need to refer to them, but we'll spend about 30 minutes in total on this scenario. And again, we'd like people to take an opportunity to be the academic coach role, and then someone else to play the resident role of Taylor. And then we as observers will be looking through the ORS checklist and providing feedback and discussion through our breakout rooms. And then we'll all get back together and debrief as well. The Google Drive link is once again in the chat. So if people want to open it up, they can access all the information on Taylor.
Yeah, and there is a case 2 PDF, which is actually a mock printout of what a MedSys report could look like, just to give that little bit of extra flavor of what it might be like as a coach, kind of glancing through data. So we've given you a few of the representative quotes, but if you want to have a look, we've highlighted some of the comments that we think might be developing a bit of a pattern. So you can also have a glance at that, but hopefully you can spend most of the time role playing. Okay, welcome back, everybody. We hope you had a chance to role play another scenario and try out another example, hopefully of some motivational interviewing and chat about it. So just in terms of timing, looks like we should have, I think, about at least 8 or 9 minutes to chat as a group about that last scenario. Maybe I'll see if there are any volunteers from any designated people from any of the groups who want to give us some takeaways or thoughts that they want to bring back to the big group.
Sure, I can start from our group.
Please go ahead.
Sure. So we had Victoria and Mike go through the scenario together, which seemed very natural. And the points that I want to take away from this is that there was a lot of good process in terms of engaging a rapport, and the fact that they were like normalizing the situation, as this is not an unusual case that we see all the time. So learning about, you know, the background of what makes a person very shy and, you know, not able to speak up in that environment. And even talking about reflective techniques were really helpful in the group situation, like, you know, and empathic responses that I found that I feel like we do in a natural scenario, but sometimes maybe not in the coaching scenario. Like, you know, I feel really nervous when that happens. And, you know, saying like, oh yeah, that sounds tough is reflective, but also being like, oh my goodness, yes, that is terrifying whenever I'm in that situation. You know, like that was really helpful to know that we can do that naturally, but sometimes not in the coach setting. And also just affirming the feelings that the learner feels, you know, like normalizing their situation and not having a timeline to fix the issue, you know, like saying like, how can we help? How can we make this better? And what can I do? Like leaving it very open-ended at the end and not feeling like you have to have a solution on that first meeting. So those were some of the things that our group chatted about.
Thank you. Yeah, I think there must be something a little bit reassuring if you think you're the only person in the world who has a certain issue or has a certain behavior, to find out that maybe you're not the only person to have ever done this before, or you know, especially if you're feeling like you do want to change but maybe don't know how or afraid to. Any other feedback from any groups?
What I liked about our group, and Lauren was the one who was interviewing, is how she started off saying those things very clearly, you know, that it's not my role to judge you. I'm here to see how we can make this better for you, you know. So sort of breaking the ice in a very, very nice manner. Um, that was really a very good point for me. And, also like giving some personal reflections that sort of validates the other person's experiences, such as feeling shy and perfectionist, sort of validating those things by giving um, own example. Also seemed like a good strategy, while being careful not to project too much of your own experiences onto their situation. That was the tricky part that we found, that sometimes if you relate too much with the resident situation, you may assume certain things that they might be going through based on your own experiences. So not to be aware of where to find that boundary.
Yeah, that's an excellent point. It's very tempting, especially when we are walking. This came up in our group too. When you're in the same specialty or have been through the same training, it's easy to start to get into more of that mentorship role and figuring, okay, well, here's how I got through it, and so here's maybe how you should do it, versus let's keep the focus on you. But it does seem there is a role at times for, whether it's personal or normative relation to what's being presented to you. Thank you.
Yes, and another point that came that I liked how she kind of made her reflect, that it has been working very well for her so far. Like this kind of trait probably doesn't affect you in your junior years. And then as she steps into a more leadership role, so she tried to, kind of make Taylor think of the answers by making it open-ended in the way that she said, how may it be helping you, not just focusing on how it may be negatively impacting you. So that Taylor could first of all be thankful that yes, it did help me, because a lot of times I could just listen to other people and be the good girl, and now is the role when I have to kind of um, speak up my mind, even if it's not in complete agreement to what is being said. So I think that kind of was very nicely kind of brought out from Taylor, rather than putting in the coach's own words.
Great.
I can talk a little bit about some of the interesting discussion we had in our group. One of the personal big observations I had as a facilitator watching Mother do the academic coaching was, it was amazing to see how much can be a question. Instead of, even from a feedback perspective, when it came to bringing forward, instead of being like, okay, we're going to discuss, confidence or shyness or whatever, he's just like, all right, let's talk about your feedback. What did you get from it? What was good, what was bad, and allowing that trainee to really be the one who highlights sort of the themes and take it from there. That was really neat to see, about how almost everything can be sort of a question, and really watching that was really nice. The other thing that we kind of discussed was that idea of what we're focusing on. In the introverted trainee, we talked a little bit about how much do we want to try to make everyone into the extrovert, or lead them into this theme of being the traditional leader, versus working with their own inherent strengths, and maybe focusing on some behaviors that it's okay to be an introvert. And be shy, but maybe it's a matter of, but in this situation, you may just have to communicate this. So there's that shared team, shared mental model with the group. And so we, that kind of balancing act between being able to have the behaviors to ensure effective team communication and patient safety, but still letting that person be who they are, and working within that, and allowing the learner to sort of facilitate that growth, I think allows for that as well, as opposed to just being told, no, you need to just be, you just need to be louder, or whatever it may be. That was an interesting conversation to have about how much is personality versus how much is behaviors, and what are we really working on.
Great, thank you, Naveen. Blake also put in the chat, maybe from his group, that on the part of the coach, that sort of discussing expectations and role setting is important, because even though we may be meeting as a coach and coachee, there, almost certainly for most of these interactions will still be some level of power differential. So trying to level that out or explain that from the beginning would be hopefully set the stage for more open communication. Probably
I think the other thing that came out in our group was, and I will quote it and give the reference due for whoever it came from the person it came from Blake Yaraskevich, actually, where it's opening the door but not prying. So how much does the coach kind of ask about things that can be personal and that can feel like prying versus opening up that safe environment and the trusting environment to have the resident or the learner feel comfortable sharing some context that might be beyond academia, that might be influencing their performance or their evaluations. And similarly, once once the resources have been provided by the coach to the coachee, in terms of following up, what's the role, what are the boundaries for the academic coach, and keeping it open for the learner to come back and let the coach know if they feel comfortable doing so, but also not having that as an expectation. And so that came up from our group as well.
Yeah, that Blake, a poet and a neurosurgeon. It's fantastic. All right, I think that's 11:45, so I'll wrap up there, but I'm sure there was lots of other great things that came out in the small group. So thanks for sharing the points that you have.
Thanks. I think I'm up next to Catherine here back. We're just have a couple of minutes and just, I think, to remind and kind of just tune into the fact that sometimes in the academic coaching relationship that we've been talking about, it does establish somewhat of a different relationship between, the coach and the trainee, in a way that does allow for some more personal disclosure and some sharing of how the residents' personal life is maybe affecting them in their academic training, which is very helpful and I think very, very, very often very helpful to the resident. And I think always reminding ourselves of kind of where our boundaries lie, which will be different in a coaching relationship than they are in some of our other relationships. And that I find that kind of visual kind of helpful in terms of thinking about our zone of helpfulness. So when are we kind of not offering enough or inviting enough personal sharing or reflection? When might we be over involved or sort of requesting or encouraging almost too much of that? This is a picture. This is a picture of my puppy again, who's not supposed to be on the couch, who now just puts her front legs on the couch to let me know that this is her boundary, even though she's not supposed to be doing that. So it's just to remind us of boundaries. I think the other thing, next slide, please. I think the other thing we wanted to just point to is the importance of knowing what resources are out there for a resident. If you feel as though they are coming into issues that are of a more personal nature, or you feel like they would like to or would benefit from kind of further exploration of those issues, I think one key thing is always reminding folks that it's important to have a primary care physician or a family doctor, and that you can't list your iPhone as your primary care physician. Next slide. I did want to just also remind of the office that I work in, which is resident affairs, which is always that available to you as a coach in working with your residents. If you feel like, or they feel like, or are wondering about sort of exploring some issues in a more personal way, very much at arm's length from their programs, that you can encourage them to reach out to us. And the next slide, please. And also, we will attach all of these slides for you so that you have them. But of course, we have sort of local resources within resident affairs. There's also provincial and there's national resources as well. Next slide. I just want to dig in just very briefly to some of the local resources, so that sort of on the right hand side here, that's a little bit of a busy slide, but many of you will know the left hand side sort of within programs and for program directors as resources. But from a resident affairs side, in our office, we have myself, we have a counselor usually Lisa Giles, and now we have KK Akinboyo, who's replacing Lisa on her maternity leave, and we have an administrator. And so residents can book directly online into appointments with myself or KK, or right now we also have Dr. John Miller helping out in our office. And so that's just so you know, and there's also other resources. We have quite a bit of information on our website as well. The other thing that's sometimes helpful to know, there is a recent group that's been forming called Racialized Residents at McMaster, with some resident leadership there, and there's further information on the website as well, among a few other groups. And that's another way that sometimes residents can connect with particular other groups of residents who may be kind of offering kind of peer support and facilitation. So I'm not going to go into all of the details, but just to say, of course, there is a resident affairs person on every campus. So it's myself here at McMaster, at Waterloo, it's Dr. Kathleen Nolan, and in Niagara, Aidan Jeffrey. And so also there's information on the PGME website about all of them. And then, of course, there's other, moving to the next slide, is more about the more details on resident affairs, but also to the next slide on, oh, sorry, I think we stopped there, on provincial resources in the form of PARO, the PARO hotline, as well as some of the national resources. So, but the easiest, closest to home resource to know about if a resident is experiencing challenges or difficulties, or just wants to talk about some personal issues, especially if you feel like it's moving outside of kind of your scope of comfort, or where you feel like this might benefit from further exploration. Really strongly encourage you to encourage the resident to book in with us, either directly into our schedules or to email the office and ask for an appointment with someone. So I'll just stop there and turn it back over, I think, to Irene.
Thank you so much, Catherine, for kind of taking us home and bringing it kind of to natural end. I guess really, I put the slide up to say, we kind of talked at the very beginning about the role of the coach, but I think today, the big message is that it takes a lot of different skills and a lot of different hats and a lot of meetings and establishing that trusting relationship to effectively do these quote unquote duties of a coach. And so interpreting the data, promoting reflection, preparing for the competence committee, debriefing, all the long time, establishing and reinforcing that education alliance really does take a lot of skills and communication and motivational coaching. Today was just the start of exploring these skills and an opportunity to start practicing. We realize and totally appreciate that this is not going to be enough. We are underway with developing tons of different resources for our coaches, and we will be disseminating those hopefully shortly. But we also do encourage you to take the opportunity to practice these skills during your coaching interactions with your learners. Allison has just put up a link to the Google Drive that has the slides that Catherine presented, as well as a few others that give you specific resources at the local, provincial level. So please feel free to access that through the Google Drive that's in the chat.
And thanks, Irene, for moderating. Great workshop. It was wonderful.
Thank you to everyone for your participation, your active participation, and we look forward to seeing you in our future initiatives. Have a great day.